Hello friends, today we are going to discuss about a very important question, that is, are the results of hair transplant permanent? A lot of people ask me this question and there are different views about this one. This is really important because it makes a huge impact on your psychology. Friends, nothing is permanent in this world. Change is the only constant. So hair transplant is no exception. Let me explain this by giving an example, and that example is myself. I have undergone a hair transplant surgery in this eyebrow scar over here, and I underwent this surgery around 3 years back, and the hair were taken from back of my head. So initially these hair used to behave like the scalp hair, and they were little thicker than the eyebrow hair, and they used to grow in length very fast. Like in every 15-20 days I used to cut these hair. But now over a period of time these hair have adapted according to the recipient side. So these hair have acquired the characteristics of recipient area. Now they have become little thinner and they don't grow in length that fast. So now these days I usually cut these hair in 2 to 3 months time, and that's very significant because hair taken from back of your head when implanted in this area can also acquire the characteristics of recipient site sooner or later. So you may notice thinning of these hair, and there might be little reduction in the number as well. So a lot of people don't accept this or don't expect this. Now this is important. Uh, Many patients, they undergo surgery and they get good hair back on their head. Probably their clinics didn't explain them about this, so they did do any medicines. They thought the results are permanent, and once they have done a hair transplant, nothing else is required. So these patients usually come to me after say 2 years, 2.5 years, 3 years of their previous transplant, and they have new bald areas, and probably this is because of loss of the existing hair, non-transplanted ones, as well as because of thinning of transplanted hair. As you can see in this patient, we had done around 1700 grafts, and now if you see this, he had good density after that many grafts, but over a period of time, the second picture which you are seeing was taken around 3 years later, and we can see there is a significant thinning. Probably this was because of the fact that this patient didn't follow the medications as advised to him. What are the precautions which one needs to follow after a transplant to take care of his existing hair as well as transplanted hair? Number one is medication. He needs to use minoxidil, biotin, and in some cases even finasteride if required. Now these medicines do help, but sometimes we need something extra, like PRP or laser treatments can also help. So the purpose of making this video is to educate you guys so that you keep this fact in your mind while deciding and going for a transplant. I believe that if you have the correct information, you can take the right decision. Unfortunately, because of the commercialization of hair transplant and hair loss treatments, people don't tell these things. If you knew all these things beforehand, that really would have been good for you. I hope this video will help you in taking an informed decision. If you like the content of video, please press the like button. And if you want more information, You can subscribe our channel, which has a lot of information and a lot of educational videos. You can also follow me on Facebook and Twitter. Thank you. Love yourself. Stay blessed.